Gallbladder problems can strike silently, often after the age of 40. But what are the hidden signs your body is giving you? Why do these warning signs often go unnoticed until it's too late, leading to emergency surgeries or life-threatening complications? How can you spot the symptoms early enough to avoid drastic measures and protect your health? Uncover the truth behind the pain, the discomfort, and the mysterious changes in your digestion that could signal something serious. Are you aware of what might be happening inside your body right now? And how prepared are you to take action before it's too late? Gallbladder function plays an essential role in digestion, especially in the absorption of fats. This small, pear-shaped organ, located under the liver, stores and concentrates bile, a liquid produced by the liver that helps break down fats in the small intestine. After the age of 40, gallbladder problems, such as gallstones, become more common due to changes in bile composition and gallbladder motility. Enjoyed this content? Then don't miss out on the other videos on my channel. I'm sure you'll find something that catches your interest. And if you haven't subscribed yet, make sure to hit that subscribe button and turn on notifications. That way, you'll stay updated with all the new content and help the channel grow even more. I'm counting on you. Factors such as hormonal changes, diets high in fat and cholesterol, and even the use of certain medications can contribute to this increased risk. Understanding the function of the gallbladder is crucial to recognizing the importance of your health and preventing complications that can arise over the years. Gallstone formation occurs when there is an imbalance in the components of bile. This imbalance can result in crystals that clump together to form stones, ranging in size from small grains of sand to large stones that block the bile ducts. This obstruction can cause severe pain and lead to more serious conditions, such as acute cholecystitis, an inflammation of the gallbladder that may require immediate surgical intervention. Physiological changes with aging can impact bile and its ability to keep its components dissolved, making it crucial to understand what triggers these problems in order to take preventive measures. In addition, gallbladder health is impacted by diet and lifestyle. Diets high in saturated fats and cholesterol, combined with a sedentary lifestyle, can increase the risk of gallstone formation. Practicing a balanced diet and maintaining a healthy weight are effective preventive measures. Understanding these risk factors is critical to recognizing the early signs of gallbladder problems and to taking actions that can prevent the development of more severe complications in the future. Common symptoms of gallbladder problems. Abdominal pain is one of the most telltale signs of gallbladder problems, especially after fatty meals. The pain is usually intense and localized to the upper right side of the abdomen and may radiate to the back or right shoulder. This symptom, known as biliary colic, can last from minutes to hours and usually indicates the presence of stones that block the flow of bile. This blockage causes pressure within the gallbladder, leading to inflammation and severe pain. Recognizing these symptoms is vital, as ignoring them can result in serious complications such as infection or even rupture of the gallbladder. In addition to abdominal pain, nausea and vomiting are common symptoms that often accompany gallbladder problems. These symptoms can be mistaken for minor gastrointestinal problems. But if they persist, especially after fatty meals, it's a clear sign that something more serious may be going on. The continued presence of these symptoms can indicate chronic inflammation of the gallbladder, known as chronic cholecystitis, which can lead to permanent damage to the organ and increase the risk of infection and other serious problems. Jaundice, a condition in which the skin and eyes turn yellow, is a warning symptom that a gallstone may be blocking the common bile duct, preventing bile from flowing properly from the liver to the intestine. This can lead to a buildup of bilirubin, a yellowish substance that forms after red blood cells break down. This is a sign that the situation is worsening and requires immediate medical attention to avoid more serious complications, such as pancreatitis or generalized infection. Early identification of these symptoms is crucial for proper diagnosis and treatment. When to seek medical help. Seeking medical help quickly when experiencing symptoms of gallbladder problems can make the difference between a simple recovery and serious complications. Severe and persistent pain in the upper right abdomen, especially if accompanied by fever, nausea, or jaundice, is a clear sign that something is wrong and should not be ignored. Hesitation to seek treatment can allow gallbladder inflammation to become an infection or gallstones to completely block the flow of bile. leading to life-threatening complications like septicemia. Medical evaluation is essential to determine the severity of the problem and appropriate treatment. This may include imaging tests, such as ultrasound, to confirm the presence of gallstones or other problems. A rapid and accurate diagnosis allows for life-saving interventions, such as surgical removal of the gallbladder in cases of acute cholecystitis. Additionally, early identification can prevent the development of pancreatitis, a painful and potentially deadly condition that occurs when gallstones block the ducts that carry digestive enzymes from the pancreas to the small intestine. Ignoring symptoms or delaying seeking care can lead to serious complications, such as gallbladder perforation or infections that spread to other organs. Therefore, awareness of the severity of symptoms and the importance of a rapid response is critical for anyone over the age of 40, especially those with known risk factors. Early prevention and treatment not only improve outcomes, but also reduce the need for more invasive and complicated interventions. Treatment and surgery options. There are several treatment options for gallbladder problems, ranging from dietary changes to surgical interventions. For those with mild symptoms or small gallstones, a change in diet may be enough to control symptoms and prevent the progression of the disease. Low-fat, high-fiber, and moderate cholesterol diets can help reduce gallstone formation and relieve existing symptoms. Medications may also be prescribed to dissolve small gallstones, but this is a temporary solution and stones may return if diet and lifestyle are not adjusted. When symptoms are severe or gallstones are large, surgery may be necessary. Laparoscopic cholecystectomy, a minimally invasive surgery to remove the gallbladder, is the standard treatment for cases of acute cholecystitis or symptomatic gallstones. This procedure is generally safe with a quick recovery and few complications. Gallbladder removal is generally well tolerated, and most people can return to their normal activities within a few weeks. However, the decision to undergo surgery should be carefully discussed with the doctor, considering all the risks and benefits. In more severe cases, such as infection or risk of gallbladder rupture, emergency surgery may be necessary. This is a critical situation where time is of the essence to avoid major complications such as peritonitis, a potentially fatal inflammation of the abdominal lining. Even after gallbladder removal, it is crucial to maintain a healthy diet and control risk factors to avoid digestive issues and ensure a full recovery. Understanding the treatment options available and acting quickly can make a big difference in quality of life and the end result. Recovery and post-surgical care. Recovery after gallbladder removal or cholecystectomy can vary from person to person, but usually involves a few weeks of special care. In the first few days after surgery, it is common to experience some pain and discomfort, which can be managed with pain relievers prescribed by the doctor. It is important to follow the doctor's instructions regarding diet and physical activity to ensure a smooth recovery. During the first few weeks, it is advisable to avoid fatty and fried foods, as the body is adjusting to the absence of the gallbladder, which can cause temporary digestive discomfort. Most people return to their normal activities within 1 to 2 weeks after a laparoscopic cholecystectomy, while those who undergo open surgery may need a longer period of recovery. During this time, it is crucial to follow a light and balanced diet, gradually introducing foods that may be more difficult to digest. The body's adaptation to the lack of the gallbladder means that bile now flows directly from the liver into the small intestine, which can cause changes in the digestion of fats and the consistency of the stool. Being aware of these changes and adjusting one's diet as needed can help minimize symptoms and improve overall well-being. Post-surgical care also involves monitoring for signs of complications, such as fever, severe abdominal pain, or signs of infection at the incision site. These symptoms should be reported immediately to the doctor, as they may indicate infections or other complications that require urgent medical attention. Staying informed about what to expect during recovery and strictly following medical guidelines are essential steps to ensure a hassle-free recovery and a return to normal life. Proper preparation and care for digestive health are essential for a healthy future after gallbladder surgery. The health of your gallbladder can change dramatically after age 40. But what do you really know about the silent signs that can indicate a serious problem? Why do so many people ignore symptoms until it's too late? And how can small changes now prevent major surgery in the future? Let's explore together the warning signs you can't ignore, the treatment options you've never heard of, and what really happens when the gallbladder is removed. How do you ensure that your digestion is not compromised, and what do you need to do to protect your health in the long term? Stay tuned, because every detail can be the difference between peace of mind and a medical emergency. Are you ready to understand what your body is trying to tell you?